Hello and welcome everyone to this seminar on Unlocking One COVID-19 Present Scenario and Way Forward. I am Dr. Bhupesh Diwan from Zuventus Healthcare Limited. I am the Director of Medical Services, and today we have a very eminent panel of speakers with us. To start with, I will introduce the first member, that is Dr. Ashok Kapse. For introduction, Dr. Ashok Kapse, he passed his MD in 1974 from GRMC Gwalior, and he is ex-National Chairperson IAP Infectious Diseases Chapter. He is ex-President IAP Surat, IAP Gujarat. First to report about dengue break in Western India way back in 1988, confirmed by NIV, Pune and CDC. Awarded 9 oration awards by different academies. He's medical excellence. He's got medical excellence award in 2013 by India Today Group for research in dengue. He delivered more than 500 lectures in various conferences and CMEs, including international, his 8 international CMEs he has already presented and delivered. He's contributed chapters to many books and published many articles in national and international journals. So with this brief introduction, I would like to hand over to Dr. Ashok Kapse. Dr. Kapse, pleasure to having on this panel, and please start the discussion.
Dr. Bhupesh, for your very kind words. I think I'll go for full screen. Well, friends, welcome to my talk on COVID-19. I'm going to discuss certain issues. In practice, I see a lot of challenges which are going to come my way in coming months. And I would like to give you some way forward out of this. Friends, you all know it was 7 December 2019 when China broke the news that a new coronavirus been detected in a case of pneumonia from the city of Wuhan. It gradually increased, spread all over the world. Then initially, we thought that it would remain contained to only China, but then it spread all over the world when it started creating huge problems in Western world, particularly Italy and all that. Soon it came to our country also. Initially, cases were imported from people who came from abroad. They gave infection to their family member or a close contacts. The person went into society. Then secondary cases erupted. From these secondary cases, other cases erupted, and now we are in a tertiary sort of a transmission where we do not know which is the contact, and still we are getting the patient. So we are already on what you call community transmission in certain areas. We all know about the portals. Certain slides I would just rush because they are things everybody is knowing too well about them. So main portal is of course nose, throat, but conjunctiva could also be there. We know that it's an aerosol, and actually when it is an aerosol, droplets would be infecting the person who is nearby. The person staying away may not be infected. Then we know that it is causing sort of a surface contact. It is dropping, the droplets are dropping on the surface. We touch them, we take it to our nose, we take it to eyes. All these things are too well known to you. The question came whether it's airborne or not. I mean, this was the issue which ought to have been cleared long back, but unfortunately it did not, and because of that, we did not get the advice of proper masking. Virus can remain, small microparticles can remain in the air for few minutes to few hours. That's not small. If the number of patients are more, then virus can be there in certain environment and can cause infection. And the only way to protect from that kind of infection is everybody well-fitting masking. Well, if it is aerosol would disperse with the air for a little longer thing, and that our do gaj ki duri wala concept may not be very true in that situation. There are transmission puzzles. Not that every patient is behaving in the same way, every city is behaving the same way, every locality is behaving the same way. And one of the most puzzling thing right since beginning, it was observed that good number of cases, in spite of very good contact tracing, some 55% cases we could not find out where the contact is. And then it was thought maybe that certain people do not have any kind of a what you call symptoms, and they may be infective, what you call asymptomatic patients. Well, again, studies came up which showed that viral load depends on the what kind of disease. If the disease is mild, virus load will be less. If the disease is sort of a severe, virus load will be more. Than looking to that with asymptomatic patients, how much virus load they would have. But still, if the number of them is very large and if they're in close contact of us, they can positively infect us. Now, this is the dynamics of mild versus severe disease. It has been observed that to begin with, in the first few days, first 6 days, I would say, even in the mild case, you would find lot of virus, while in the sort of a severe case, you may have virus, but in mild case, nasopharyngeal excretion or shedding is quite high. Then as the time passes, around 7 days or so, this excretion starts going down. Around 10 days it will disappear, but in severe it will continue for a long time, maybe sometimes for even a month or so. As I said, there are certain cases which have got a too much of what you call generation of virus in nasopharynx. And why, we do not know. They produce a lot of virus, themselves don't suffer, but they keep excreting. Such are the person who behave like a super spreader. They are not badly infected. They are moving in the society. Some of them are asymptomatic or very mildly symptomatic, but they create a problem. Why this kind of changes? Why a certain place has got a certain person has got this thing? That's because the RDRP gene is liable to be lot of mutations. So the virus which we see in Lucknow may be different from the virus in Delhi, or maybe in Delhi in particular area, there may be in different area, there may be different virus. It may not have a big difference in pathogenicity, but transmission and all that, it can definitely make a difference. We all know incubation period is around 5.2 days, but in certain cases it could be as short as 2 to 3 days, and certain cases it could be as long as 14 days. Then infectivity period, you all know, it is nearly 14 days. In severe cases it is 3 to 4 weeks, but in mild cases it could be 14 days. But it has been observed that after 7 days you may detect virus in nasopharynx, but viability of that virus is very poor. So what you call cycle threshold is more than 35 or 6, and this virus is no more infectious. It may be detected, but not infectious. Now this is a sort of a graph which shows about the viral load. Initially virus, you can see that it goes up around 3-4 days, then it starts declining. 7 days on, it becomes less. There are other aspects, but I will not touch them in this graph. You all know that virus goes through ACE receptors in the body. Now the question is whether ACE receptors in body are more, it's good or bad. Matter of factly, ACE receptors are protective receptors. They are anti-inflammatory receptors, and the lack of these receptors would cause a pro-inflammatory situation, more cytokine storm, and more damage. Pathophysiology, there are 3 aspects: infection, inflammation, and coagulopathy. Now over here again I will come to this chart. There are a good number of patients, very large, 80 to 85%, who would behave like a mild disease. Viral load will go around 7 days, it will disappear. But there are certain cases where viral load continues for a long time and it doesn't come easily down. It excites what you call chemokines, cytokines, and what you call CSS cytokine storm. At the same time, it also excites pulmonary idiopathic, pulmonary intravascular coagulopathy. Cytokine storm, you all know, I don't go into the details, but it can cause widespread damage to the body. This is something very peculiar to the virus. It causes pulmonary intravascular coagulopathy. And there are small thrombi, emboli all over the lungs. That's why you get a diffuse picture in sort of a lungs and what you call diffuse peripheral involvement causing ground glass appearance. Coming to the symptoms, we all know very much. Majority diseases, upper respiratory tract infection, nose, throat, fever, cough, and throat pain. Only few cases, 15 to 20%, where infection percolates down to the lungs. And when it percolates down to the lung, it causes shortness of breath. So among whole the symptomatology, most important thing is shortness of breath. As I said, 80 to 85% cases are mild, 15 to 20% cases cause lower respiratory infection, what you call pneumonia. If you would see the distribution of cases, mild cases are very large, then you have got a severe cases and few cases, 3 to 5% may be critical. But there is a big chunk of cases which are not detected. And they could be detected only by one way, and that is random sampling, which is not being done these days. As a result, cases, they are moving in the society, spreading infections. Now, I have seen this issue of asymptomatic cases very sort of closely, right from China and all that. I find that compared to other countries, China, Italy, France, other part of the Western world, our chunk of asymptomatic cases is very, very large, almost 80%. Then, of course, there are stages of infection, mild, moderate, severe, critical. This is the timeline. Initially, infection is mild, but around 7 days or so, in certain cases, it may develop into a sort of a respiratory difficulty, shortness of breath, and that is where a patient would require admission. But once this shortness of breath starts, within no time, patient become dyspneic, they may go for a respiratory failure, and patient may go into ICU and this. So initial 7 days, okay, but once those 7 days have passed, the next, suppose patient continues disease, then within 7 to 10 days, majority patient turn serious. Is COVID other than RTI? Yes, it is other than RTI. It could be gastrointestinal symptoms in terms of diarrhea, it could be abdominal pain, it could be vomiting, there could be systemic. What is systemic? Maybe there is fever, arthalgia, myalgia, sort of a lot of body pains, something like our dengue presentation. You all know risk factors and all that. I don't go into the details of that. But one thing I would like to discuss. Disease is not only of old age. The concept that disease is only of old age and it's only after 60 that you need to worry and before that you can have a disease merrily. No, that's not the right concept. This is a chart which shows age distribution in Maharashtra, in our own country. And you see from 21 to 50, majority cases are there. It's only beyond sort of 60 and all that cases are less. I agree, mortality is more beyond 60, but among these cases also there are a good number of cases which are going into ICU, turning severe. So we have to be watchful. And of course, it's very clear that youngsters, they go out, so they get infection more commonly. When it comes to children, I would say it's a child's play. The disease in case of is just a child's play. A mild disease, not only mild disease, transmissibility is also less. Chances of pediatricians getting disease are very little. I mean, I had searched whole literature, I found that majority disease are in adults, means from patient to doctors. When it comes to pediatrician and pediatric nurses and all that, very few of them infected. Not One more good thing, they clear virus between 5 to 7 days only. Don't remain infective for a long time. Why? Paucity of receptors, pollination with other viruses, but the most important thing, children are endowed. God has given them a special protection in terms of effective innate immune response. What is that? We have memory cells. Out of these, there are dull cells and bright cells. These dull cells produce natural IgM antibodies. They are non-specifically containing the novel pathogens. So effectiveness of children fighting a novel pathogen is much better than an adult. Would there be co-infections, co-viral infections? Yes, there could be flu virus, picornavirus, coronavirus, other coronavirus, adenovirus. Almost 25 to 30% cases have double infection. So if a person get a rhinorrhea, and we say in total number of COVID cases, 4% have got rhinorrhea, those rhinorrhea cases could be rhinovirus plus this. So there is a possibility that this kind of a thing might be existing. And recently we had a hyperinflammatory syndrome. We really do not know whether it is really linked to coronavirus or it was some virus, other virus joining with this. You know how to test, diagnose the patient. Every day it is in the press. Viral detection by RT-PCR, antibody testing. One good thing is antigen testing has also been added by ICMR to the battery of these tests. Viral detection by RT-PCR, I mean, we are hooked upon RT-PCR. Yeah, today, so many cases, so many doctors, so many days turn positive, but the sensitive test is just 70%. So with one test, you have a 30% chance of missing the infection. Maybe 1 or 2% false positive also. Nothing very great. But then 1 to 2% in a population of 80 lakhs infected, that would be huge. So this test needs to be further developed. It should be improved. It's not a gold standard test. Now we all know there are a lot of these testings are not enough, so we do not detect the case. It was perfectly okay initially when the cases were in few hundred, few thousand, few lakhs. But now when the cases are so much, it's impossible to test each and every one. Our one cities of 250 lakhs, Delhi, Mumbai, they are going to get so many kits. This is today morning's data. 64 lakhs 27,000 tests till far been done, and we have about nearly 3 lakhs 80,000. Now positivity rate, which used to be 5% till we did unlocking, has gone to 16.8%. And of course, out of this, cases are more concentrated in certain places. So if you count or test Delhi or certain part of Mumbai, maybe this positivity rate could be still more, 25-30%. Antibody testing, well, they say it's something like very simple. They say कि by 7 day it is 70%, 8 day 80%, and it's not for diagnosis, it's for community surveillance. I disagree. I want this test to be available to me in my private practice, particularly along with antigen. I cannot have RT-PCR in every case, but if I got an antibody testing, antigen testing, which are comparatively cheaper, I can make something out of my cases. Well, admission policy, as soon as a case is detected, admit it. Not only that, the whole building will go into the quarantine. I mean, we created a sort of a monster out of this COVID. And the result is Bombay hospitals, Delhi hospitals, Surat hospitals are full of minor fever cases, minor pharyngitis cases, nasopharyngitis cases who do not require hospitalization. And those who really are bad, they are really going from one place to another place, no bad. What I would suggest, asymptomatic, they should be in home only. Mild, they should also be in home. Moderate onward cases you may keep. Now this will lessen the burden on hospitals, and as the burden is lessened, people, doctors, nurses, they can concentrate more on the patients who really require hospitalization. Treatment, well, you all know antivirus, anti-inflammatory, anticoagulants. I don't go into the details. We are using repurposed drugs. All this list you all very well know. I am very much convinced that if you convalescent plasma at right time, around 7 days of the sickness, lot of problems could be decreased. Now this was a study, France study, we showed that combination of azithromycin SCQ clears virus on 5th day. Since then it has become standard of treatment all over the world rather. Now, as I said, convalescent plasma, it can decrease viral loads effectively. US, France, all these countries, they are now going big way for plasma therapy. Early treatment with plasma would be better results. Prevention, well, we have no vaccine. As we do not have vaccine, we have to go for non-pharmacological things. And one of the most important thing I believe is mask. General public roaming on the road can have a sort of a cloth mask, but if they are in the hospital, they should have at least surgical mask. And me who is treating the patient should have proper N95 mask, shield and everything. Then of course, as we know, proper hand hygiene, then cough etiquettes, and most important thing is social distancing. Well, to such a huge country of 135 crore, teaching all these things, inculcating these kind of habits in them, which was never there it was very difficult. So on the first case, we found out on 30th Jan, cases increased. Around 25th March, it was 500 cases, and ICMR and everybody, they thought these cases are not getting contained. As a result, on 20th March, we went for a national lockdown. Initially, it was for 3 weeks, then one more extension, 4 weeks, and by and by, we came to the 31st May. This was a turmoil time, social turmoil, political turmoil, economic turmoil, lots of migrant labor problems and all that, and the benefits of lockdown, which we otherwise would have reaped, we did not reap that much. Ultimately, government decided to unlock it. On 1st June, when we unlocked it, cases which were 500 was 1,90,000. Deaths which were very few, counting well on fingertips, were 5,384. Does that mean that locking was absolutely useless? If you look at the number of cases in USA, their daily cases, you would find them within 1 month of initiation, they reached 30,000, 35,000. It remained like for almost 1.5 months, and it's only for last few days numbers have come down. But now come down means what? It is still 20,000, 25,000. There was very poor locking in USA. When it came to India, if you look at it, initial cases were few, and it remained, this is the lockdown period, almost up to 31st May, and the cases remained in range of say 5,000, 6,000, 7,000. Now they have started going up, and we have reached up to almost 14,000 now. It did help. It gave us time to prepare everything. Unfortunately, we falter on that. Result today is in big metropolis where really number is high, where there is a shortage of bed, we have to make makeshift hospitals. Now this makeshift hospitals concept is really very difficult. You can always make hospitals, buildings, beds, everything. Where are you going to get doctors? Where are you going to get sisters? Staff is a huge big problem. Shortage of healthcare workers everywhere. Healthcare workers are getting tired now. And the result is residents, nursing staff, they are doing work of everything. So there is a huge problem of healthcare workers, beds and everything. And now our ICMR says, क्या रखा है इस डिसीज में? 90% केस तो माइल्ड होते हैं, घर पे ट्रीटमेंट हो जाएगी. But you have created such a huge scare initially that one case in a building of 100 flats, you lock down whole building. Now you say आप आराम से घर पे रहो, दूसरों को infection नहीं होगा. Who's going to trust you? The biggest problem is now trust. Patients are not trusting. Those who are influential, they will get admitted in big hospitals, they are able to pay. Those who are poor, they do not have a facility for sort of a hospitalization or facility for isolation at home. They are in a bad shape. What challenges I find ahead? In last week only, after the rains, what I'm seeing, there are good number of cases of ARI. In last 2 months, there were very few cases of ARI. Now they are going up. Fever cases coming month, they would be increasing. There would be dengue, there would be so many other diseases. This is season for diarrhea, this is season for neurological cases. And these all are the cases where COVID is in differential diagnosis. What am I going to do with this case? Am I going to test all of them? Is it possible for me to test all these patients? Well, I may be having a known case of asthma. He developed a superimposed infection, and with infection his attack is triggered off. What am I going to do? Am I going to test this patient? And if I want, would the government permit me to test? That is one of the challenges which I am going to face. Well, sorry, all cases are being reported to government, and when they analyzed, they found that number of SARI patients is much less in female. Adult males, they are much higher. If you see the SARI cases age-wise, 0 to 19 years is hardly any cases, COVID cases among SARI cases. This is IGMR kind of research, and there are hardly any cases. The majority cases of COVID among SARIs you see between age of say 40 to 60, 69. Means the same age group which is vulnerable for COVID in among the SARIs also. Rest of the cases. Suppose I get a SARI patient, I personally feel I need not to test it. I can treat it unless a patient behaves differently by third day, fourth day, fever keeps on jumping, hypoxia not relieved with my routine measures, then only I would consider. Otherwise, I keep on treating my SARI patient as I have been treating for the years. Well, dengue is going to create a huge problem. Both are hyperinflammatory conditions. Whether dengue would add to COVID, COVID would add to dengue, and how, suppose I admitted a patient on dengue, 5th day is not improving, should I go for testing? Once suppose I test and is positive, is it because of COVID or because of dengue? Well, there will be a lot of problems. Only unless I get experience, treat them, then only I will be able to answer these things. What way forward I have? One is I should have a point of care test. I mean, this RT-PCR totally sort of in the hand of government. That's not. I must have dengue test like dengue, COVID or antigen test as a point of care test for me, so that I can, my hospital, in my small nursing home, I can test and come to a diagnosis. Now, this antigen detection test has recently come up. It's a sort of a standard Q COVID test. It's a chromatographic immunoassay developed in Korea. Well, I must have it in private so that I can do something for my patients. Dose sensitivity is not very good, but combining this with antibody test, I'll be able to make out something of it. Now, COVID test, this, you know that this combining these two would help. Now, what about my other patients, other issues? Well, I need to continue with my vaccination. And particularly, I had to promote flu and pneumonia. That's two vaccines which I have to specially promote. Timely treatment, well, there was a concept of teleconsultation. Okay, for adults, I find it very difficult. In spite of my proper taking history, talking to the mother, examining child, I tend to miss the cases. How it is possible that she shows me a child on sort of a WhatsApp and say, you treat this patient? No, that's not possible. Timely treatment, it's okay for a day or two, you could treatment of fever and all that, but if patient has got any alarming sign, I must examine that patient thoroughly, investigate, treat him, as I have been doing it for a long time. I have to reorient my practice. Well, there are majority pediatricians, general practitioners, where the tendency is patient would come and sit in the clinic. Clinic would be crowded, there would be a lot of waiting hours. That has to be This is not possible. I have to educate my patient that you need to take appointment. Sort of sort of a concept for the patient that you have to take a doctor's appointment in our country. I have to insist for appointment. Few patient with a child, I may permit only 2 people. My clinic is stuffed with the toys and all that. I have done away with them. They have to bring their own toy sheet so that they do not infect each other. Children, well, it's very difficult. I can tell parents to avoid touching surfaces. Children, it's very difficult. Then, of course, my sitting arrangement have to be reoriented. There should be enough space. Sanitization before they enter, at the entry, at the exit. एंड फॉलोअप्स. हमारे पेशेंट्स को बड़ी खराब आदत है, 2 दिन में ठीक नहीं हुआ ना, तीसरे दिन फिर आके साहब अभी कुछ फायदा नहीं हुआ है, अब बुखार तो उतर गया, खांसी चालू है. Now this kind of follow-ups have to be on the phone only. We have to teach them, we have to be little strict about it, we have to orient them. Very peculiar. Children, one child is sick, mother will bring other child also because there was nobody at home to take care of this. Healthy child, grandparents, accompanying to clinic to be totally stopped. They should not visit the clinic. And the most important thing is mask. Mask for me, for my staff and every patient. I made it a rule, no entry without mask. There are many patients who do not like it, but I say you go down, get from medical store. I have taken sort of a mask from a person who sells in wholesale. They are giving for just 5 rupees, but then it has to be there. And we have to teach parents that you should wear mask properly. बात करते समय आपको मास्क निकालने की जरूरत नहीं है, नाक खुली नहीं रखिएगा, ठुड्डी खुली नहीं रखिएगा, लूज मास्क मत पहनिएगा. Matter of factly, these days my consultation with every patient, these things I have to concentrate. When they learn these things, they go out and definitely they will tell to other people also. But mask is the most important thing right now for my clinic and for everybody, for me also. It's not that it's for them only, it's for me also. If person is not in mask, he's asymptomatic carrier, I'm coming every day, 10 asymptomatic sort of people, I may get infected. The contact time would increase. So mask is very important. Of course, babies do not require mask. They cannot be given mask. Then now the question comes, what to do with these patients? Huge lot of patients. Should I, suppose I get a patient of 5 years old who I suspect and detect as COVID, should he be admitted? If suppose he got a plain pharyngitis, why should he be admitted? He can be. If when you admit a 5-year-old child, he has to accompany with somebody also. Maybe some father, mother, they are also at risk. So at home. Now what kind of a thing? Of course, we have to ascertain that patient and mother would be in a room. There could be some other person who can take care of other things. Then, of course, this thing could be promoted. But I would say that if we have to lessen the burden on healthcare workers, on our hospitals, we'll have to promote this home isolation, home treatment. Then how I'm going to get that patient is serious? Well, shortness of breath, I'll have to teach that this is thing. Maybe I would see the patient on FaceTime or WhatsApp once or twice a day. And of course, I will have to keep lot of this small instrument in my clinic. I may lend them, you can take it home. And whenever patient has got once or twice, you see this number, report us. So this is how we have to reorient our practice. I need my personal care also.
Dr. Kaus, I must 1 minute left.
Just another 5 to 7 minutes. Yes. So chemo protection I have to take, and SCQS, zinc, vitamin D, C, it's my chemo protection. I must have good sleep, food, physical activity. I have seen a lot of my friends who suddenly have lost a lot of weight. क्या हुआ भाई? अभी तो खा पी के आराम कर देना है. बोले सर बहुत स्ट्रेस रहता है. How to manage small nursing homes? There are no patients, they are not able to take out, there is no break even. I mean, youngsters, they are going into stress, and this, I think I look ahead to Piali to address to our professional stress also. क्या अगर सपोज मैं एक्सपोज हुआ तो क्या होगा? शायद हो भी गया हूं. अगर मुझे पता चला कि मैं एक्सपोज हुआ, what is this? Risk of infection to me, of course, would be there. I may get infected. What about serious disease? Well, I am 72. When everybody told me कि भाई आप बंद करो साहब practice, आप क्या this person, your age is. So I went through this chart. The worst chart is of Italy. And what I realized that even if suppose I get infection, I have 87% chances of survival. 12.5% I may die. 87% chances that I would survive. If it is 60 to 69, the chances 96% chances. Why not to take it as survival chances? Why we are saying death chances? COVID doesn't mean a death warrant. So at 72, I'm taking for stop my clinic. I continued working. I'm going to hospital, doing everything. Of course, there is some problem. Chemo protection and all that is very important. In case suppose I get exposed, I have to treat myself, home quarantine, that would be important. But simply exposure is not indication for home quarantine. If I am symptomatic, then I'll go for home quarantine, not otherwise. बहुत सारे लोगों का ये कहना रहता है कि साहब फैमिली मेंबर्स का क्या, मेरे घर में मदर फादर है, इफ सपोज ऐसा है, so you put them in lockdown, you put the parents in lockdown, your elderly in lockdown, babies in lockdown. Well, wife has as much risk as you have, but if suppose you are exposed, then it is better that majority time you remain in mask in family also. Children, well, I'm not really much worried about children from 10 years to 20 years. It's only under 2 years, there is some worry about it. Friends, we have created a huge big monster. No doubt, it's a problem. No, but without working, how are you going to find out a solution to this? The fear, the panic, confusion, it has converted this pandemic into what we call panicdemic. Everybody is so scared. I mean, of course there are cases, of course there are deaths, of course there are problems, but then who's going to solve it? Medical professionals going to solve. We are like warriors. Messages, all kind of dirty messages, all kind of scaring messages, and because of this, health education is very important. And a person like Dr. Piali, Shilpa, you have to take leadership in our hand. Politician is less trusted. As a doctor, I am more trusted compared to those people. So we have to take this in our hand. And of course, my thanks to Juventus and of course Meenal and this system. I'm getting this kind of a facility today for webinars where I can teach people. I have to be a social educator, and that's the most important. Again, thank you so much for Juventus and for giving me this excellent opportunity to put forth my views.
Dr. Kapse, it was really a very, very interesting and lucid topic which you have covered in such a short time. I know if you were given more time, it will be much, much more elaborate, which you can do it easily. And the slides were really fantastic, excellent slides. Thank you so much for your contribution. So with this, I would like to invite Dr. Piali Bhattacharya to convey her topic. And just to introduce Dr. Piali Bhattacharya, she is a consultant pediatrician, DCH MD, FIAP FRCP, PGDIP Guidance and Counseling, Jamia Millia. She is having present affiliation with Sanjay Gandhi Postgraduate Institute of Medical Sciences in Lucknow. Her major achievements, she is president of Uttar Pradesh IAP 2019. She is executive board member of CIAP from 17 to 18. Joint zonal coordinator IAP Central Zone 2019. Member State AEFI Committee on Immunization, 17 to 19. Then there are several honors and awards and publications. The awarded state awards are 32nd and 37th and 39th UP Pedicon. National winner in the Jagran Awards for Excellence in the Field of Social Service for the year 2015. Member National Advisory Board Indian Pediatric 2017. Member Advisory Board Child Today Journal of UP IAP 2018. Her publications in national journals like IP, IJPP, JIML, EA, and IAP textbook of vaccination, etc. International publications, Journal of Virology Methods, Coordinator Media Cell, AHA 2019, Chairperson IAP Mahila Ayog 2020 of Vishaka Committee, National Coordinator Women's Wing of IAP 2018 and 19, Academic Committee Member Adolescent Health Academy 2014-15, Adolescent Health Ambassador Mission Kishore Uday 2013, and many more. So she is a very reputed speaker, and now I would like to invite her to present her speech without taking much any more time. Dr. Pyali Bhattacharya, please.
Thank you, Rupesh. It's a pleasure talking for all of you. Let me start sharing my screen. So, as the coronavirus pandemic sweeps across the world, there is a widespread concern, fear, and stress. About 60% of the world's population today is living in a partial lockdown, and the rest, about 1.5 billion people, billion children, are out of school today. So having said that, Dr. Kapse has already said that it is not a pandemic, it is a fear-demic almost, anxiety-demic. So when we say that, we need to understand why it is so. So initially, the general perception was that the novel coronavirus spares most kids. But studies have been contradictory to this general perception, and we have found that hundreds of children below 12 years have been infected in India. I have shown that though it is a minuscule, I have shown here today's COVID stats in India. There are about 395,000 cases and confirmed cases, deaths of around 12,948, and about more than 2.5 lakhs are cured. So that is actually a very nice statistics to have compared to countries like America and Italy. But we have to keep in mind that there are children who have contracted the disease. Not only contracted, though the fatality rate is very, very low, but there are casualties of COVID-19 amongst children as old as just 45 days. So having kept that perspective in mind, we also need to look into the psychosocial effects of this COVID-19 pandemic on the children. Buddha has said that there is nothing in this world that can trouble more than your own thoughts. So we need to concentrate on what the stressors are. Are there some stressors? Yes. There is a disruption of the total normal pattern of mankind, more so in case of a child who has lost the sense of structure and the stimulation care coming in therein. There is a restriction of movement. The child has lost his playground. The child has lost his school. He is being forced to stay in a social isolation at home. We all know that forced quarantine is always a stressor. The important thing is that doing it voluntarily. So now what is there is, what about the studies? The children are very worried. So the government started online schooling. However, in most of the children who have taken their board exams, there is an uncertainty about the further career. I know of many children of my friends who have been given seats in Ivy League colleges but are uncertain about going to America or about going to Harvard. So that part is actually taking its toll as a huge stressor on the adolescent child. Then we will gradually come to media exposure to fake news. And of course, we must remember during the lockdown period, like at the present moment, the state border of UP Delhi is locked. So those whose families, loving people are sort of separated and staying in another state and are unable to come home, that also becomes, separation becomes a stressor. And having said that, if there is unfortunately a death of a loved one in the family, then it is a huge stressor. We know of many children in the suburbs who used to come to the school just for the midday meal. So remember that these children existed on that midday meal. Now that too, the schools having gone online, the midday meal has also stopped. They are worried about their nutrition, about their food. Kahan milega khana? So remember, there are so many stressors already. So are they taking an adverse effect on the mental health condition? Yes. Number one, the child having lost his normal pattern of activities, there's a lot of confusion and adjustment problems. Then, of course, as Dr. Kapse has already said, there's a lot of fear and anxiety around. In the little ones, it has been seen that fear and anxiety also lead to cognitive impairments. Now, going ahead, we find that these children, once they are cooped up into their houses, they are irritable, they are angry, they are in a low mood, there is also insomnia. Now, all this with online exhaustion, with a lot of problems associated, there is an emotional exhaustion, ultimately a depression and an increase in suicidal behavior. As I said, there is a lot of grief and mourning, which also adds up to adverse mental health conditions when they lose a family member. Not only that, I will also talk about media and the eye stress. We have had several children coming to us with watering eyes because of the amount of online learning and additional media that they have been taking up. Not only that, with this media, because the child is not going to school, does not go to the playground, he is now depending on the media, and there is always a risk of an online predator. There is also a fear and anxiety about the disruption of regular mental services. If you remember, we were not holding any OPDs for the last 2-3 months, and a poor child who had asthma was so anxious, Dr. Uncle to milenge nahi, hum jayenge kahan? So that is also adding to the adverse mental health condition. We all know that there is an entity called post-traumatic stress disorders. So there's a warning already rising that there is going to be this kind of a feature also in the children and adolescents. And it has been seen already and reported in Lancet that fear rises in about 20% of subjects in quarantine, and PTSS occurs in 28 to 34% subjects in quarantine. Issues specially affecting the girl child, having been sort of going to school actually relieved her from a lot of household chores. Now, since nobody is coming, the house helps are not coming, mothers are actually delegating responsibility of caring for the relatives, of several household chores on the girls. The family is staying together, and in certain families, the familial conflict is rising, and there is, of course, an increased gender-based violence, there is abuse, and many a family we are finding during the lockdown period also, बच्ची की शादी करा दो और भेज दो दूसरे घर, हम कितने दिन खिलाएंगे. So there is a rise in child marriages, there is a rise in child pregnancy. Another special issue is when we talk about the marginalized section or the mental health risk, which rises disproportionately amongst children and adolescents who are disadvantaged and displaced. So the migrant children are in a state of constant fear and in a constant state of panic. Also, the shelter homes and camps they are staying in is not very conducive to mental health. There is also a risk of stigmatization. Many a person has traveled back from Mumbai to his village and found that he and his children are being ostracized from their villagers itself. So we've seen that these migrant people, there have been multiple deaths, there have been suicides, there have been lack of medical care and attention, there has been exhaustion and also quarantine center deaths. Having said all this, then who is responsible for looking after these children? When I say so, there's a huge role of parents, of schools, of we pediatrician uncle and aunties to ensure that the kids are in a proper mental state during this pandemic. First of all, parents must recognize the cues. If the child is throwing excessive tantrums, if the child has not been eating or lost appetite for his favorite things, if the child is facing difficulty in concentrating, which she never used to feel, if the child is experiencing trouble sleeping, these are some soft cues which the parents need to pick up. So how do you help? You need to make a routine. As I said, existence of a routine, a systemic behavior is very helpful for the children because they have lived it all their lives. So you need to make a routine. ऐसा नहीं है कि ये vacation है. This is not a vacation. So you must not take it likewise as well. Other thing is, you must provide assurance. Children have their queries, they have their anxieties, they want to ask certain things. But उस समय, if you say that अभी नहीं बाद में आना अभी काम है, so you've lost it. So listen to them. Listening means not only listening to their queries, it means listening to their physical cues as well, their body language, their tone of asking. So all these things become important in the light that you need to actually answer their queries. So age appropriate queries. A few days back, I had a sort of video circulating, which was also sent to me, in which the little child is asking her mom, "माँ ये कोरोना क्या है? ये कोरोना क्या है?" After asking 3 or 4 times, the mother who is cooking the food, वो झल्ला के बोल रही है, "कोरोना बीमारी है, हम सब मर जाएंगे." So this kind of a thing, again anxiety. The child starts weeping uncontrollably and then says कि हम सब मर जाएंगे, अभी तो मुझे स्कूल भी जाना था. So we actually need to look for these silent emotional cues and talk to the child about it without avoiding them. And avoid being judgmental. हम लोग भी घर पे हैं, हमारे ऊपर भी बहुत सारा काम है. But if we be judgmental and we say, चुप रहे, तुझे तो सारा टाइम रोना ही होता है, या चुप रहे, सब समय कौवे की तरह काए काए करता जा रहा है. So remember again, the child will shut up and then internalize his behavior. So do not get irritated. Do not be judgmental. About exercise, yes, there is a definite role of exercise. Now that the child has lost his playground, we must engage in the indoor activities like some indoor games, hobbies, household chores, some kind of a skipping, some kind of a purana जो हम स्टापू खेलते थे, maybe in your courtyard you can make those squares and let the child hop, skip and jump on that, or do yoga. So it's been scientifically seen that exercise raises the endorphin levels and stimulates the neurotransmitter norepinephrine. These are actually linked to mood deprivations and mood elevations. Again, the exercise itself boosts immunity by recirculation of key immune cells and mediating an anti-inflammatory antioxidant state. So exercise becomes a little necessary even during the pandemic lockdown. Next comes yoga. When we say yoga, we smile, but there are about 17 poses of yoga, including breathing exercises, pranayamas, the moon-shaped one, the child-shaped one. There are about 17 best yoga poses which have been found for anxiety, depression, and stress. So when I advise children, I simply tell them to do the square breathing. That is, you count at a count of 4, inhale, keep it for 4, and then exhale for 4, and then again hold for 4. So that way you make it a square breathing. So you can simply start with simple breathing exercises, go in for some pranayama, and then go in for more and more yoga. Coming to meditation, spirituality, and mindfulness, it has been seen that sometimes when you are giving CBTs or psychotherapies, you are giving antidepressants, you're giving everything for mood elevation, it may be not enough in certain amount of children or adults as well. So meditation and spirituality, these two things have been found very, very helpful if there is a child who is concentrating on spirituality. तो अगर आपकी बच्ची या बेटा धूप दीप अगरबत्ती करता है, do promote that so that he will understand, he will calm his mind, and he will settle down into that part of spirituality. Now, mindfulness, we must talk where science meets mindfulness. Researchers in Massachusetts General Hospital and Harvard Medical, they have shown that mindfulness meditation can change the brain in depressed patients. What they did functional MRIs, and they found that there were changes in the brain activity in the amygdala, which is the seat of emotion. So we found that mindfulness activities do help in anxiety and depression. Having friends, हर एक दोस्त कमी ना होता है. So remember, happiness is being crazy with crazy friends. So what we can do is let them, they have lost contact with their friends. So we can actually allow them some mobile, some video calling, or even some fun activities. We live in a community. So what we did, we asked them to play Antakshari together. We put them on the video conferencing platform, and so happy they were. They talked for 3 days. उसने वो गाना गलत गाया था, वो झूठा था, लेकिन ये वाला तो सही गाया था. हाय, उसने कितना अच्छा गाया, पता ही नहीं था. So remember, if they are in contact with friends, with family, and if there is some fun activity associated, it is actually a bolster to the moodiness. Ask them to be generous, to help others. So we've seen that wherever there is a support group, it is always better in lifting your mood. So just a simple wishing a good day to your neighbor actually is a mood elevator. If you're out for a walk, why not say good morning and a good evening and pass on a smile to the other one? Though most of us who are in masked faces may not show the smile, but the smile does light up your eyes as well. Now, asking is one thing that can prevent a lot of mishaps. So ask, how are you? Do you need help? If the neighbor next door needs help with the grocery, the child can always travel down and go and get something for him. Or if the uncle or the grandma neighbor needs some medicines, it's always nice to help out. And gratitude and being generous actually are very, very mood elevating. Now I said I would talk about media and fake news. Now remember, we must control what amount of media we are ourselves seeing if we want to save the child from all these alerting news from the media. So 10 minutes in the morning news, 10 minutes in the evening news is enough. Have a family media plan so that you know what you are doing. You are a role model. So if the father and the mother is constantly on media, shifting from one to the other channel, trying to find out कि कहाँ क्या हो गया, अरे इटली में इतने मर गए, अरे अमेरिका में ये हो गया, अरे सूरत में फला हो गया. So remember, the child is catching on. He is following his role model's behavior, and he's actually becoming more and more anxious. So filter negative media. And of course, this is the time when you teach them media literacy. Every media is created for a purpose. So what is the purpose of this media? Once the child does a critical analysis about who created this media, why created, so who, when, why, where, actually need to be taught to the child now so that they can be safe from fake messages and fake news. This is one photograph which almost everybody will recognize. He's been in news. So 1 in 60% in our country are affected by suicide. That's what the NCRB statistics 2015 says. But the present psychoanalysis, the psychiatry community is saying that it is rising in India by 20 to 30% during the lockdown period. Just today, there was a news that a girl without smartphone fails to attend online classes and kills herself. This kind of news of depression, of suicides are on the rise. We thought that maybe the little ones are not affected, but a survey in Italy on the impact of lockdown and children have said that they're becoming more irritable, have trouble sleeping, and even the youngest one was so affected that he wept inconsolably and regressed developmentally. So, what are the signs then of depression? Are our children depressed? We can have internalizing signs and we can have externalizing signs. The child may just go into a kingdom of his own. He might close the room and just sit and mooch there. The child may avoid family. The child may avoid social situation, if any contact with his friends. Now, another way is that the child becomes aggressive, becomes abusive. He's not sleeping too much, or he's sleeping too much. And not only that, he is feeling guilty. अब क्या होगा, अब तो कोरोना आ ही गया है, अब तो मेरी पढ़ाई खत्म है, अब तो मैं कभी ज्वाइन ही नहीं कर पाऊंगा फला यूनिवर्सिटी, मेरा क्या होगा. So feeling of worthlessness, of helplessness. So remember, if these feelings, if these symptoms last beyond 2 weeks, increase in severity, affect sleep, appetite, school performance, and there is actually an inability to perform the routine tasks, they need immediate intervention, and you need to seek the attention of a health specialist. So remember, suicide prevention, if you have nobody, just call 112. That is our emergency app. And if a child so much as so says that I'm feeling worthless and I feel like ending my life, do stay with that child until professional help arrives. Many a child were stuck in quota. I remember many a parent were very, very frightened about what is going to happen to their child. And I said, do call them up every day routinely and stay with them. If you find if there is one small inkling about any such thing as depression, send somebody who's near them, or talk to another friend who will be with that person day in, day out, and the friends will help out. If there is an inkling, do remove any medication, any potential harmful object, and listen to the person. When you actually communicate with a person, there are three ways. You can be verbally communicating, you can be just actively listening, or it can be just a non-verbal communication. All of you will be very surprised that the verbal communication reaches the person just about 7%. It is the non-verbal communication which affects the person about 93%. And of course, Brutus, lend me your ears. So everybody must lend an ear and without judgment. अरे तू तो पागल है, तू तो ऐसा सोच भी कैसे सकता है, and the child goes and commits suicide. So remember, without judgment, do listen, ask if the child is feeling not so good, and the child will ventilate of thought. Many a times the ventilation of thoughts is very, very helpful. And if you think that one of the children you know or your own child is having the thoughts of suicide, a hotline can be of help. So this is the hotline in my city, but All India helpline is also written at the end, so you can have the All India helpline also, and they do give a little expert advice on how you can go about supporting someone who
the time
has a suicidal tendency. So remember, concentrate. Okay. I'll be finishing in a minute. So within your control, there are some on things within your control, your thoughts, your health, your life. Be grateful for the blessings that you get. The role of the pediatrician is very important. The pediatrician uncle and auntie can help the parents understand and pick up the small emotional cues. The parents are disturbed, so you can normalize their emotional responses by talking to them, by listening to their queries and solving them, and focus on the emotional awareness. Give them life skills and coping strategies. So, managing depression is through support, psychotherapy, or drug treatment. I must put in a word here about special children with disabilities or trauma experiences, or those who have already existing mental health problems, because we found that these health problems start around the age of 14 years. So these are the ones whom actually you need to counsel and impart some coping skills. Family connectedness does help in these special children. So the take home message is rule of 138: eat well, exercise, relax well, rediscover the hobbies and be busy, sleep well. Personal hygiene is important. Timely medication is important. Along with the do's, the don'ts become very, very important. Avoid too much caffeine, avoid alcohol, and be media literate. References: there are some very good UNICEF and WHO sites, and there is My Hero Is You. You can find videos, you can find advice on parenting, on healthy children during the COVID times in these sites. And I will finish. I am from Lucknow, so I will finish with a small शायरी. न किस्सों में है और न किश्तों में है, जिंदगी की खूबसूरती चंद सच्चे रिश्तों में है. Thank you very much. Wait till the schools open again and another pandemic comes in again for all the children who are going to open up the school, and there's another going to be a real thunder with the pandemic going and the school reopening. Thank you so much.
Thank you so much, Dr. Pyale Bhattacharya. It was such a educative and lucid session. Like, we couldn't even blink our eye to continue to see the slides. It's so interesting. Very, very nice. You have covered almost all the topics, including socioeconomic factors and the child psychology and everything. So this is a very, very good session. I now take you to Dr. Shilpa Joshi, and let me just put her CV on the screen. So Dr. Shilpa Joshi is a consultant dietitian. She is Secretary, All India Association of Advancement Research in Obesity, Director, Mumbai Diet and Health Center, practicing dietitian, diabetes educator, Vice President, Indian Diabetic Association or Dietetic Association from 2019, and she'll continue till 2021. Master Trainer, Diabetes Conversation Maps, published more than 13 papers. Course Director, National Diabetes Educator Program, trained more than 3,000 diabetes educators, presented at various national and international meetings, including American Diabetes Association, International Diabetes Foundation, and International Confederation of Dietitians. Runners-up recipient of Wimfener Guggenheim International Essay Award of Academy of Nutrition and Dietetic Foundation on Malnutrition. With this introduction, I will like to hand it over to Dr. Shilpa Joshi. Dr. Joshi, can you hear us? I think you're on mute. Yeah. Just on the bottom left of the screen. Yeah, thank you.
Okay, so thank you, Dr. Diwan, and it was such an excellent presentation by Dr. Kapse and Dr. Bhattacharya. Honestly, it was a big learning experience while attending this webinar. So what I'm going to be talking about is about impact of nutrition on children, and like Dr. Bhattacharya said, there is a huge emotional component which goes in selection of food. And I'm going to cover both what is with respect to immunity, but also because now after being post lockdown, we are expecting at least the parents or others in the house to sort of go out, go to work, or at least start going out to do basic chores, and they might get infection at home. We know that the prevalence of infection among younger kids is lesser than adults, like Dr. Kapse said. But even then, what we need good immunity. So I'm going to devote some of my talk to immunity, but I'm also going to devote my other time to discussing what actually happens while selecting foods in India. So what has been the effect of lockdown? There has been reduced physical activity, prolonged sedentary behavior that has been linked to both negative physical and mental health outcomes, such as loss of muscular and cardiorespiratory fitness, which has led to weight gain, psychosocial problems, like Dr. Bhattacharya said, and maybe it will lead to poor academic achievements later on, because kids are really not themselves. Now, income has hugely been affected, especially for poor householders or even middle income class, where a lot of people have actually lost their jobs, and their purchasing capacity for food has completely changed. So what people are actually now eating from nutrient dense food like fruit and vegetable, or proteins like dal. See, most of the vegetables, at least in Mumbai, are about 50 to 100 rupees a kilo. Most of the dals are more than 100 rupees a kilo. And you are not going to expect people to buy that when they have actually lost their jobs. Even eggs have become like 10 rupee a egg sometimes. So things have become very expensive. So what people are actually opting to eat is just rice, wheat, or millets in case of India, and that also what they are getting through public food distribution programs. So they are really not able to buy so-called protective foods, which come into the bracket of fruit and vegetable, or even proteins. So that's a huge problem, and we know that there is a huge healthcare impact, because like Dr. Kapse said, patients are not wanting to come to the clinics for even they're only going to clinics for emergency checkup. So for non-emergency things such as immunization or the other things, they may not go, and they may lose that chance to actually get nutritional counseling from their healthcare providers. And this in turn, poor nutrition in turn will weaken their immune system and jeopardize body's ability to fight any kind of infection, especially like Dr. Piali said, that a lot of kids are actually dependent on that mid-meal which they are getting from school, and that's probably the only decent meal that they can get within that day. So I think even supplementation program like that of vitamin A supplementation, or distribution of oral rehydration salt, etc., is all going to get impacted. There are some studies which have actually shown that there is some amount of anecdotal evidence from Asia where women were even concerned about breastfeeding their infants, because they thought that breast milk could actually pass on corona to the children, and therefore that even breastfeeding was getting impacted. Other big problem was availability. Even in higher socioeconomic families, you were seeing that during the lockdown period, availability of vegetable, fruit, animal sourced food, they were essentially the source of micronutrients in the diet. But because supply chains were so drastically affected, for example, where I live, I usually order my grocery from Big Basket or other kind of, they would not come. So all this, or your vegetable vendor would not come. So all this was actually getting, your food intake was getting impacted. Now, this is something which I actually thought which was most important, that there was so much of misinformation which was leading to malnutrition. So actually WHO on its website has put that it is very unlikely that you can catch corona from food. But even then, we were having people not eating vegetables, not eating fruit, because a lot of times you're eating them raw. So fruits you typically eat raw, and people thought that if they're buying fruits raw and they're eating it raw, then there is no chance of virus being killed. and therefore they could get corona, and they were actually not eating food. Also, they were mishandling the food. I have known so many people actually making surf ka pani and putting vegetable and fruits in that and washing. So this is like mishandling the food, and this all actually could lead to malnutrition. So children are actually more than just small adults, and they actually need nutrient supply for immune system development, and inadequate nutrition would weaken their child's immune system, susceptibility to disease, increasing severity of illness and slow recovery of disease. And it may not be with COVID. Like Dr. Kapse said, there are 100 other viruses around. There is dengue around. There is 100 other problems on respiratory infection, and the immunity in general drops. And we know that there are various facets of immunity. It is not just your immune cell, but it is your skin, your mucosal lining. For all of this, you need good nutrition. So all of this malnutrition can actually, and stress can actually lead to breaking up that pool of immunity. Now, what is reality of immunity in India? Undernutrition has been estimated to be associated with 50% of all child death, and child undernutrition in India is responsible for about 22% of country's burden of disease. So low immunity due to undernutrition can be effectively addressed by just providing proper nutrition. You do not have to do fancy foods, and this is something I want to tell people, that it is fancy food does not equal to immunity. It is not your quinoa and broccoli and capsicum that is going to give you immunity, but it's your guava and your jamun that you get for cheaper rates that's actually going to give you immunity. And there are studies to show that nutrition actually impacts immunity, impacts T cell function more than B cell function in most of the nutritional deficiency. Now, there is a lot of studies which have shown that westernized diet, which impacts immunity the most. Now, whenever we talk about westernized diet, everybody talks about one thing, pizza and burger. And they come to my clinic and tell me, Madam, hum to nahi khate pizza burger. You don't have to eat pizza burger to eat westernized diet. What is westernized diet? Is a diet which has high saturated and omega-6 fatty acid, reduced intake of omega-3 fatty acid, overuse of salt, and overuse of sugar. Are these not the diets that we eat every day in India today? This is what we eat, and as a function of our eating that, we also feed our children this. So whether it is pakoras and samosas, they may not be Western in principle, but they are ultimately a part of westernized diet. And this is what most of the children are eating. In fact, during lockdown, there was a huge wave of women cooking at home and posting it on Facebook and posting it on Instagram to show what they were making. And I was following it very closely. Rarely would anybody post something healthy. So they would post very, very fancy recipes, which were most of the time very high in salt, very high in sugar, and highly processed food, having maida, lacking fruit and vegetable. So like, there was a joke that Corona is going to last till all women across the world make cake once. So, cake, for example, high sugar, high fat, high maida, all of this actually impacts immunity. So underweight also impacts immunity, so does overweight, because overweight is pro-inflammatory condition as such, and there is also silencing of warning system because of it being pro-inflammatory in nature. And this is same holds true for children, and we see there is a lot of increase of childhood obesity, especially now when there are no avenues for child to expend that energy. There is no like we all know, playgrounds are closed, schools are not there, so there are no physical activity classes, even other classes like where children go to dance or maybe play, these all have stopped, and hence there is no expending energy, and that may lead to overweight or obesity. Now, this is something which I really wanted to show, that sugar actually impacts white blood cell phagocytosis. And when you mean sugar, you also mean jaggery. So a lot of times kids, especially young children in India, are given a lot of sugar and sugary products. And that is something that I'm not saying don't give them at all, but one has to limit the amount they are taking, as well as salt. Salt also impacts immunity a lot, and lot of times people think it's the white salt which is bad, because it has been taught to us that everything white is bad: salt, sugar, maida. But all salts, senda namak, kala namak, Himalayan namak, namak is namak, and all namak for you is not really good, and you only want to take it in required amount. We see children eating excessive salt when they eat ketchup, they eat uh, pickles, they eat crisps, namkeens, all of that, that impacts immunity. Also intake of saturated fat. You know, when people used to say, you know, you give ghee to a child, remember that time kids used to play out a lot, and it all of that would get utilized. Nowadays, most of the kids, even whether lockdown or no lockdown, most of the kids are only playing on computers. They are really not going out and is expending that kind of energy. And this saturated fat, in India, processed meats are eaten less, but ghee, butter, coconut oil, fresh coconut, all of this have a capacity to impact immunity, because they are very pro-inflammatory in nature, and they produce pro-inflammatory cytokines and prostaglandins in our body, and that actually leads to hampering of immunity. So can I boost my immune system through diet? So this is WHO guideline for COVID. You cannot boost your immune system just through diet or a specific food or food supplement that will prevent you from catching COVID infection. But good hygiene practices remain the best way of avoiding. But one thing which is important, that they are not recommending one food over another, but what they are actually recommending is this word called as nutritional diversity. That means you need to eat food from various food groups. You need to eat food which is protective in nature, which has plenty of vitamins and minerals, which will support functioning of a normal immune system. Now, we know that malnutrition is now defined as both undernutrition and overnutrition. Earlier, when we spoke about malnutrition, we would only look at emaciated kids and call them malnourished. But now we are seeing kids who are overweight are malnourished in vitamins and minerals and proteins sometimes, and that is something that we need to remember. Now, for this August audience, I don't think I need to talk about how much of micronutrient deficiency is there, but yes, we see a lot of zinc deficiency among all regions in India, because foods which are rich in zinc are either of animal origin, or the rich sources come from nuts and oil seeds, which are also expensive foods. But now when we say nuts and oil seeds, everybody cannot afford almonds and walnuts and other things. It's okay even to eat peanuts. But it's very important that if child has no nut allergy, these things are given to children rather than expending or spending same amount of money on buying something which is processed, like, you know, chips or any other kind of crisp which is there. So immunity and nutrition go hand in hand, and there is a cycle of malnutrition leading to low immunity, leading to infection, and which again leads to poor nutrition because of the disease. And that is actually the reason why there is also immunosuppression, because of micronutrient deficiency. So micronutrient deficiency really causes reduced nutrient intake, increasing nutritional losses, and it interferes with utilization by altering metabolic pathways which come, and therefore undernutrition will lead to infection and low immunity, and low immunity will again lead to infection, which will again lead to undernutrition, and this cycle just continues all the time. And therefore one needs to break this cycle. You can begin here, which is looking after your nutrition in general. So if, you know, we know that common infections caused due to nutritional deficiencies are typically gastrointestinal and respiratory in nature, and therefore we want individuals to eat a very well-rounded diet which is rich in vitamin C, vitamin E, selenium, copper, zinc, to counteract which potential damage which is caused by oxidative species, and therefore which will affect the production of cytokines and prostaglandins in our body. Now believe me, one thing is to take it in pharmacological doses, but another thing is to eat more well-rounded. And remember that the sources of vitamin C and vitamin E are not very expensive food. The richest source of vitamin C on this planet is avla, and avla is really not very expensive. Richest source of vitamin E are all the sprouts. And sprouts can be done at home and given to children. Even zinc, like I said, even simple sources like peanuts can be included in child's diet, which will give enough zinc. So these are different micronutrients and where do they act? So you have a role of all the micronutrients in either cellular immunity or B cell based immunity, which comes from antibody production, or we have epithelial barriers where every place you have vitamins and minerals besides the macronutrients like protein and essential fats, which become very, very important. So here we have evidence now that zinc supplementation may actually help in normal development and function of cells, regulating non-specific immunity, including natural killer cells and neutrophils. It also impacts T lymphocytes, and also zinc deficiency adversely affects the function of macrophages through dysregulation of cytokine process, intracellular killing phagocytosis, and it impairs antiviral immunity, and hence it's mandatory that we need to supplement. And therefore it was very well documented in adults, but also now is documented in children that if you give them enough zinc, it's good for them. So therefore undernutrition will lead to infection, will lead to mortality and poverty, or even now with people losing job, it's not even poverty, even middle class is facing this burden of undernutrition, and hence food-based strategies have been recommended as first priority to meet micronutrient needs. And for that, what you really need is dietary diversification. Means if you actually talk to most of the kids and ask their mothers what do they eat, the answer is bhindi ki sabzi or roti, or gobi ki sabzi or roti, or aloo ki sabzi or roti, and they don't eat anything more. Or if it's dal chawal, then it's just dal chawal. I think what is very essential is exposing child to different foods. I'm not saying expensive food. I'm saying different foods. There are hundreds of green leafy vegetables available in India. They can be added to different foods to create nutritional diversity. It's important that they are exposed to different pulses, they are exposed to different seeds, so that they get, no single food can supply all the nutrients. It's not a pharmacological supplement which can supply all the nutrients just by taking one capsule. And also one has to remember, dietary diversification is important is because it maintains a balance between nutritional and anti-nutritional factors, and that is actually the most important thing in maintaining good health. And hence food-based approaches to meet micronutrient intakes should be given first priority. Greater dietary diversity has been associated with growth and better micronutrient status. Food-based approaches to improve micronutrient status on improving general quality of diet by increasing fruit, vegetable, and animal product intake. And if this is not enough, then additional micronutrients can be given. So these are few sources of vitamin A you get from dairy, you get from eggs, you get from fruits and vegetables, which are rich in carotenoids, which are typically orange and red and yellow in color. Iron, zinc, and vitamin B12 usually you get from animal sources. Folate you will get everywhere. Folate is widely present in nature, so you want to give them. So all these kind of micronutrients are important. Fortification is not a thing in our country. We do not have fortification of all micronutrients. Iodine fortification is only one which has been effective in the country. We really need more fortification strategies, especially which concern vitamin D, vitamin B12, because remember, dietary sources of vitamin D and B12 are only non-vegetarian foods. In our country, people are vegetarian, even non-vegetarian people eat vegetarian most of the time through the year, and therefore it is very necessary that these kind of nutrients like vitamin D, like vitamin B12 should be used in fortification strategies, and we need to actually sensitize our government to fortify foods with vitamin B12 and vitamin D. So in conclusion, nutrition has an impact on immunity. Various micronutrients, vitamin and minerals do have impact on immunity. Diets in children in India are poor in micronutrient due to overemphasis on carbohydrates and fat. No mother in India ever asks her child, "तूने दाल और सब्जी खाया क्या?" Only thing they ask, "कितना रोटी खाया या कितना चावल खाया?" So there is only emphasis on carbohydrates. There is no emphasis on protein. There is no emphasis on protective foods like fruit and vegetable. And all fruits and vegetables which are chosen need not be expensive. There are a plethora of inexpensive fruits and vegetables which are present, which are important. Like, I always say the saying goes, an apple a day keeps doctor away. That's because this saying was created in England where apples were rampantly available. In India, apples are expensive. You don't have to eat an apple. A guava a day can also keep a doctor away, and guava is not very expensive. So you need to, and National Institute of Nutrition has said that the king of fruits is not apple, it's actually guava. It's the healthiest fruit available in India, and one can eat it all through the year. Most of the food eaten by children in India are overcooked and often reheated. This reheating is a very big problem in India that leads to nutritional losses. In India, a good mother serves her food to her children garam garam. That's the thing. Then even if the food is made at 7 a.m. in the morning and served at 7 p.m., she has overheated and reheated the food at least 10 times. And all micronutrients get lost, all proteins get denatured, and hence cooking and reheating and therefore handling of the food is very, very important. Food fortification is a need of our, and especially in a country like India, where most of the population consumes a vegetarian diet. Due to lack of fortified or enriched food, sometimes supplementation in young children may become very important. Thank you so much for a patient hearing.
Thank you, Dr. Shilpa Joshi. It was really a nice, lecture on nutrition. And I must say, you have a knack of making topic very interesting. You're a very lucid speaker. And guava, of course, now let's see how many of us start taking guavas daily,
It is the healthiest fruit in India, so not apple, guava.
Great, that's so nice. Okay, so it's like we have a lot of queries coming in, and our coordinator is sending all those queries on the chat box for the speakers. So we can cover a few to start with. So what I'll do, I'll give you some of those queries, which to begin with Dr. Kapse. Dr. Kapse, there is a response coming from Dr. Ashok Masan. So treatment of asymptomatic positive patients.
Very frankly, asymptomatic patients do not require any treatment. They have no symptom, they have no disease, they are only having virus in their nasopharynx. Their issue is they can infect a person who is at higher risk. But otherwise, asymptomatic patients do not require any treatment. There is one aspect to this. The French study of using azithromycin and hydroxychloroquine together has shown that it can decrease the viral sort of this within 5 days instead of 7 to 10 days. So it can make a person less infective.
Right.
That's my point. You make a person less infective, so he would not be transmitting virus to others to that extent. But these are theoretical aspects. Otherwise, asymptomatic patients really do not require any medication. I would like to give him zinc. I would like to give him vitamin D. I would like to give him vitamin C. And of course, all the nutritional aspects what Dr. Shilpa talked of, that of course is there. But otherwise, this person does not require antibiotic and all.
All right. Another question is from Dr. Shabana Memon. She's saying, is it only severe throat pain is suggestive of COVID?
Look, it's not a question of severity of throat pain because it's a perceptive thing. A child, I have seen children that there is a mild pain and they will make a lot of hula bulla, and there are other children who can bear it easily. So it's not a question of throat pain. That cannot be a diagnosis. In case of COVID, in normal circumstances, in any viral infection comes with a bang. It's a very high fever, then other symptoms, and then by third, fourth day starts a declining force.
Right.
In case of a bad COVID, majority COVID would also be doing the same way. 80%. But those who are on third day onwards, you may find patient not responding, fever persisting, going high up, throat pain persisting, maybe a child who was absolutely hale and hearty till far in initial couple of days now is dull, he may not be active, sort of not finding difficult to do his normal task. There where I would think in terms of COVID.
Right. I think now it's a question specifically for you, Dr. Kapse, that what is the risk to pediatrician to examine patients? This question is asked by Dr. Sharad.
I had talked in my talk also, and I would like to reassure all my friends. Not only children are having milder disease, but transmission from child to other children and adults. There are two studies which have come. One is from France, other is from New South Wales, Australia, and both studies showed that child to child transmission, child to adult transmission is very little.
Right. Okay.
Something to do with their sort of a viral load. As I earlier told you, that they've got a very good innate immunity. Immunity comes into play on first 2 days only. As soon as child gets infection, it comes into play, and days sort of a containing this. So we are happy. As a doctor, as being a child specialist, the happiest person for COVID treatment.
Great. All right. Dr. Shilpa, probably this question can be answered by you. That can one injection of vitamin D3 be sufficient as a prophylaxis for suspected COVID as immunity booster?
I think one needs to keep the vitamin D levels constant because we see a lot of drop of vitamin D. So it really depends upon where you began. So if you began with acute deficiency, then you need to bring it up to normal level and maintain it there. See, what happens is people get very overzealous. COVID hai, vitamin D do. 2 mahine ke baad they stop doing everything. So I think that is because we see there is no exposure to sunlight. If we presume that children are playing, even if you presume that, now even that is not happening. Most of the kids are holed inside the house. So there is no production of vitamin D per se, and therefore I think one needs to maintain the levels, and therefore whether it is 1 or it is more, whatever is required, one needs to keep giving until you can maintain the normal level.
So related to the same question, there is a question from Dr. Trupti asking what is the dose of vitamin D for kids aged 11 to 15?
So do you give, I am not very sure about the exact dose, but in adults we give 60,000 IU orally once a week. I do not know about younger kids. Do you give 60,000 IU per week?
No.
Dr. Kapse, yeah?
No. It's much less.
Much less.
For the newborns, we do with 400 international units. And above that, it is somewhere between 600 and 800 international units per day.
Per day. Okay.
I would like to
So it's a daily dose which is better than the weekly dose or monthly dose.
I would like to speak about vitamin D. Dr.
Hello.
I would like to speak about vitamin D.
Sure, Dr. Kapse, please go ahead.
Now, about the doses, what you talked of, somebody was asking about this. Now, the doses, there are few aspects of vitamin D where uses are extra osseous. Normally, vitamin D is for bone, that is calcium and bone metabolism. Over there, doses of 400, 600 units is adequate. But if you want to have a immunity boost up, in that situation, you require certain chemicals like cathelicidine and all that, which require vitamin D for production, and over there doses are little higher. So in terms of, say, if you, as a pediatrician, if I have to say, I would say 100 units per kilogram body weight.
All right. Okay.
That's too much.
Otherwise, say 11 to 15 years old child, if suppose you want to say, then I would say 1500 to 2000 units would be good enough for that child on a daily basis. If you want to give weekly basis, maybe 30,000 units per week sufficient.
All right. Okay, Dr. Kapse, another question is there, like how long azithromycin plus hydroxychloroquine is given if patients taking azithro plus hydroxychloroquine on second day of fever for 5 days and report came on 7th day. Should we repeat again This is a question by Dr. D.K. Gupta from Mumbai.
If the test has been taken on day 1 or day 2 only and result came on day 7, that does not mean that you have to extend the course further. 7 days course is good enough. I think with any disease, it's a question of how symptomatology respond. That is the most important thing. If I start treatment today and temperature becomes normal on day 2, by third, fourth day patient is well, I need not to extend treatment beyond 5 to 7 days. But if suppose I start treatment and by third day I find that patient is still not responding, going up and up, in that case I will have to think of some other drugs also, maybe hospitalization also. In that case, every other thing would come in.
Very true. I think just related to the same question is like Dr. Khera is asking, is it necessary to give all COVID patients hydroxychloroquine 200?
To patient, yes. Right now, this is sort of a strategy that we are giving hydroxychloroquine, we are giving azithromycin. I would add zinc also. Dr. Minal very rightly said, 50 milligram zinc is very, very important. What happens? The virus has got a very particular gene known as RDRP gene. And this RDRP gene produces RNA copies. Zinc suppresses that particular aspect, and hydroxychloroquine is an ionophore which takes zinc into the cells. So if you combine these two together, I would even give more importance to zinc plus hydroxychloroquine rather than azithromycin and sort of a hydroxychloroquine. In many adults, because of security interval and all that, there is a contraindication. But hydroxychloroquine plus this, it's an excellent combination for viral growth suppression. People are giving less attention to zinc, but I would say zinc and HCQS combination is better than HCQS and azithromycin.
Sure. And what would the dose you will recommend for zinc along with the hydroxychloroquine?
Normally for adults, we know 400 milligram is the 800 milligram is the first day dose, and then 400 milligram daily. When it comes to child, 7 to 10 milligram per kilogram body weight. For child, the dose is 7 to 10 milligram per kilogram body weight. You do not go more than 10 milligram per kg body weight for a single day treatment. And that, of course, you continue for then 7 days or so.
Now, what about zinc dose?
Zinc dose is for adults, it is 50 milligram. For children, it is 20 milligram.
20. All right. Okay. Dr. Shilpa Joshi, like, you were saying something about the washing of the vegetables. So this is a question. This is question by Dr. Ruta Menon. How to disinfect vegetables like tomato, brinjal, and leafy fruit like coriander, etc. After buying from market?
Just wash them clean with salt water. So dip them in salt water for a bit of time, and again wash them with clean water, which is without salt. Please do not use any kind of soaps and detergents. And I have seen people doing 100 people putting it in washing machine. So please, yes, there are videos of coming to me that we wash our vegetables in washing machine. Please don't do any kind of things. See, things like banana and all have very protective skin.
Yes.
So you are peeling it off and eating. So what is inside is very, very hygienic and clean. In fact, there is something called as a neutropenic diet, which we give when patients have neutropenia. In that, we cook all foods, but we never cook bananas and we never cook oranges because they are always in a hard skin. So whatever is in the skin, you do not need to bother, just wash them with water. But whatever is without skin or you are eating it with skin, just wash them clean with salt water. COVID is not transmitted by food. I want to very, very strongly say that.
Right, great. That's right. Okay, there's a specific question to Dr. Piyali Bhattacharya. Like, what are the bad effects of the forced online education pushed by government physically and mentally? This is a question by Dr. Suhas Chaudhary.
I understand there are a lot of bad effects as well as good effects as well. See, one of the good effects is that it is keeping them engaged for some time. But yes, I mentioned one of the bad effects is that there is a lot of stress to the eyes. There is also a lot of stress because of the posture that they are continuously sitting in. Then, of course, because of this online, the little kids, it's so difficult to manage. I remember my friend telling me, she's a school teacher, that there was a clay activity to be done, and actually the teacher was trying to teach them, and the children were throwing clay at the computer screen itself. Running up and down the room, the parents in fact trying to control them. So there are physical and medical problems of going online learning. If it continues for a prolonged time, I think the spectacle powers are going to jump like anything. So our ophthalmologists are creating really a racket, saying that there is a lot of problems, eye strain coming into them. So, and when you put them on the computer for 2 hours or so, they must remember the rule of 20 into 20 into 20. That is, at every 20 minutes, they must break for 20 seconds and look at things which are 20 feet away. If they don't do that, then they are in for a problem. Now, again, there is a lot of neck pain, back pain because of the posture in which they are sitting. So for these little ones, the chair should be a straight back chair, and actually many of them may not reach the ground, so they need a footstool as well, which we forget to provide them. So there are so many things that you need to actually look into when you are giving them online learning. And one more thing is, if the line is not secure, you have heard of incidences where the teacher were abused. Similarly, the students have been abused as well. So there are certain hazards. We must make it safe and we must make it healthy before we actually continue with them. Of course, IAP is actually into making online schooling and opening of schools guidelines over here. We are into making those guidelines nationally, and very soon actually we will be promoting them. I'm one of the members of the task force, so maybe in about 10 days time, 14 days time, we will be coming out with national guidelines about online and school reopening as well.
That's very good, actually. Yeah. Okay, so we have another question coming from Dr. Khariwal Harshal Liladhar. Says that can we prescribe doxycycline in severe COVID-19 pneumonia in children, Dr. Kapse?
I think there is one study which has come from Bangladesh where they use doxycycline in place of erythromycin. Now there is another theory which is coming up from what you call Italy, where they found that lot of atypical pathogens are there, or anaerobic pathogens are there in the bronchoalveolar lavage fluid, BALF.
Okay.
And they promoted they should be coverage should give antibiotic coverage should be there for anaerobic infection also. So with that premise, people are using doxycycline. But again, doxycycline for adults is perfectly okay. Under 8 years in children, that won't be an indicated thing.
Right. Any comments from Dr. Pyali Bhattacharya on this? Ma'am, your thing is on mute. Your mic is on mute, ma'am.
So, sir, it was initially no for less than 7 to 8 years old, but currently we have come up with the current recommendations that you can give it to younger children as well.
Okay, all right. Okay. Now, this is from Dr. Trupti again. She is asking a very simple question to all of you. Like, suggest a multivitamin, multimineral supplement for children to cover all the nutritional deficiencies.
Dal chawal hari sabzi. What would Dr. Shilpa say?
That's right. All right. So we move to next question, and I think there are a couple of questions left. So this is like, how effective is antibody testing and how to interpret? This is a question by Dr. Mahesh Patil from Mumbai.
Pyali, would you like to take it?
आप लीजिए सर, अभी तो आपने बताया.
So antibody testing, as I earlier in my presentation also showed you, one thing, it becomes positive little late. Normally 5 days is the time when antibodies become positive, IgM antibody I'm talking of. In case of COVID, it is around day 7. So 70% cases may become positive by day 7, and then by say day 8 it may be 80%, and maybe 100% would be positive by after 10 days. So it becomes a bit less. So initial age time, this test is useless.
Useless, of course.
Suppose you want to make a diagnosis within first 5 days or 6 days, you cannot make diagnosis with this test. But there is another aspect. RT-PCR test is positive in first 3 days. But as the patient develops antibodies and all that, and immunity, the RT-PCR test starts going down. In many of the cases, in severe COVID also, it has been observed that after 7 days, RT-PCR test is negative. Many times patients come late to the hospital. They may come in a condition of pneumonia, respiratory failure. You do the test, it is negative. It is branded as COVID negative. This negativity may be because of test has become negative over a period of 7 days. Now, in this situation, a combination of RT-PCR or antigen test, which I earlier showed you, plus a test of antibody. If suppose antibody becomes positive, IgM is positive and COVID is negative, then still I would like to treat this patient as COVID. It may be negative on RT-PCR, but because it is test is positive, antibody test is positive, I would. So I think it's not only for serosurveillance. Any antibody test like dengue or mycoplasma or any other thing, rickettsia, we are using antibody test for diagnosis, and this test also should be available for making that clinical diagnosis.
Sure. Okay, so this is the last question now. This is question for Dr. Pyali Bhattacharya. Like, how to keep the kids engaged in the current scenario?
So that is an interesting question. We all have kids. Actually, I don't know about the others, but I have been spending a lot of time on work over the last few years, and Saturday, Sunday, Kapse sir knows, basta utha ke chal dete hain for the official conferences. So in my mind, I felt a little guilty, कि बच्चों को time नहीं दे पा रहे हैं. So this, I believe, for everyone is a golden period of family connectedness. So if you have children at home, you can give them extra time. So accordingly, what I would say is, number one, build a routine, because that is what is essential in a child's life. So number one is, ये नहीं है कि, as I said, do not treat this as a vacation. Build a routine. The child must have some kind of a routine. 12 बजे तक पढ़ के सो रहे हैं, ऑनलाइन क्लास स्कूल करा रहा है, मिस हो जा रहा है. That's not to be done. They have to have a routine. Number two is that this is the time when you actually are one-to-one connected to them. So you can keep them engaged, tell them stories, not only stories of mythology, not only stories of Red Riding Hood, but stories of your own personal life. What are the struggles that you have faced? How have you come up? What are the life skills that you can impart through that? सिंपल सा हम लोग काले कौवे की कहानी, द थर्स्टी क्रो की कहानी से we can impart a lot of life skills to the child, saying that he came, he saw, so you must be aware of your surroundings, you must be creative in doing what you are doing, you think of the possibilities of the solutions. वो काला कौवा ने जैसे सोचा था कि अब मैं पानी नहीं पी सकता तो मैं क्या करूं, मैं कंकड़ लाऊं, पत्थर लाके डालूं, कितने बाद मेरे को पानी को मिलेगा. So like that, you need to teach them their coping skills, you need to teach them adaptability, you need to teach them to understand gratitude, कि आपके blessings है भगवान के आपके ऊपर, that you have so many things in your life which people have not got. So have gratitude for that part of a thing. Then हमारे कई दोस्तों ने किया है, बाहर बरामदे में जो थोड़ी सी जगह थी वहां उन्होंने स्टापू बना दिया है. तो चिल्ड्रन आर जंपिंग ऑन दैट एंड प्लेइंग, या दे हैव गिवन देम अ स्किपिंग रोप. सो सम अमाउंट ऑफ फिजिकल एक्टिविटी वो लोग कर रहे हैं. मेनी ऑफ देम आर डूइंग मॉर्निंग योगा विद देयर पेरेंट्स, मैट बिछा के और गार्डन में बैठ जा रहे हैं, दे आर डूइंग योगा इन द मॉर्निंग. अदर देन दैट, लेट देम डेवलप सम काइंड ऑफ अ हॉबी. मेरे छोटे वाले बेटे को कुकिंग बहुत पसंद है. So recent development है कि वो मेरे साथ मम्मा केक कैसे बनाती हो, so he's learned to make the cake. So आज मैंने बोला your father's birthday today, go and make the cake, you have to make the cake today. So आज unguided वो साहब केक बना रहे हैं. So they can learn baking, they can learn stitching, they can learn music, whatever it is. कापसे सर डॉक्टर अरूप राय की वाइफ ऑनलाइन म्यूजिक सीख रही हैं. She has a guru who was correcting her, teaching her online. So she's learning music. Many children would be interested in that. So any kind of activity, any kind of one-to-one connectedness is something that will always keep them engaged.
Right. No, I think it's a very good suggestion. something you have to keep doing, which is of your interest and interest of the family, and which would be useful for the child. So we should start thinking over all those kinds of activities, and because what had happened in past so many years, that we have become more of mechanical kind of beings, doing a routine which is very stereotyped. And now when this sort of challenges come, we don't have many alternatives to tell to children what to do and what not to do. This is a good suggestion from you.
You've grown apart basically from the children.
Right. Very true, very true. Okay, so with this, I think we are done with the questions from the audience. And today we have 785 doctors all across India who had joined this particular session.
Meenal, can you tell us if we are done with the questions?
Yes, madam, yes. Questions are over.
Okay.
Right. All right. So we thank you very much for such a nice and beautifully organized presentation, and you have shared your wealth of knowledge with all the audience. We thank you really so much for that. So see you, Dr. Kapse, Dr. Shilpa Joshi, and Dr. Pyale Bhattacharya again in near future.
Thank you so much.
Thank you. Thank you.
Thank you so much.